Hello, everyone. Thank you for watching this installment of the Hospitals of Providence Care Chat. I'm Rob Anderson, the CEO of the Providence Memorial Campus and Providence Children's Campus, and I am excited today and proud to be joined by Dr. Robert Asgharian, a robotic surgeon who specializes in urogynecology. Okay. And what we're going to talk about today is the Hospitals of Providence Memorial Campus, our robotic service line with the Vinci, and how robotic surgery affects you, your patients, and our hospital. So, what makes you qualified to be a robotic surgeon?
Okay, so there's a little bit of training initially. We, focus on doing a lab with the company. We come back, we get proctored. We do a certain number of cases that are monitored, and then after that, pretty much fly solo and do our cases. And depending on our skill set, what we bring into the table initially from my prior surgeries with minimally invasive or laparoscopic surgery and the surgeries that we do itself, we kind of advance the cases to more difficult and challenging volume and the caseload and diversity of cases that we do. So basically, just to be a robotic surgeon, you do have to have some prior skills and surgical experience with laparoscopy, minimally invasive surgery, and you get some training and you get some proctorships done, and then you start doing the cases. I've been doing them since the robot first came to El Paso, came to Providence actually. The first place in town that had the robot was Memorial Campus. And within a few months of the robot being introduced, I started doing cases here. I love the technology, love the things that it offered to me and to my patients to be able to do the advanced and challenging cases without having to open up patients, without having to do laparotomies, or being able to get the surgeries done, for the most part in an outpatient fashion, being able to have patients have fast recoveries, lower my risk of blood loss, the risk of infections, complications from wound infections that you get from opening up a patient, essentially doing a C-section incision for patients. You were able to eliminate that with this robotic surgery. The other thing that was very important for me was I was able to do these more advanced cases without getting fatigued and tired, and therefore being able to do more cases per day. And at the end of the day, I wasn't tired and fatigued versus laparoscopic surgery, where you do get fatigued and tired because you're standing there overextended, holding your arms out, and doing these challenging cases, and being very, very fatigued and having other people needing to help you. Whereas with the robot, you can just sit at this seat and basically sit at this console and play like a video game, but at the same time get great outcomes for patients.
Which is great, and that's why I think the Hospitals of Providence, we are one of the largest robotic surgical centers here in the region. Here at this hospital, we have 3. Highest advanced, great training, great nurses, but within the Hospitals of Providence, all of our campuses, we are one of the largest robotic profiles here in the area. And so what that means is I think there's a misconception of what a robot is. Sure. And for you, you mentioned kind of playing a video game, and describe what is that? What does a robot do? Is there an actual robot doing the case, or are you running that robot?
Rob, that is an excellent question. I'm glad you brought that up, because that question is also asked by my patients. Like, do you do the surgery or does the robot? So I do the surgery. The way we do this is we put in the ports. So typically I make 4 little tiny incisions, 8 millimeters of the size of a dime, 4 to 5 incisions all around the belly button area. We put these little ports in. And then we move the cart, which has the robotic arms. We dock it to these little ports. I sit at the console, and I'm actually doing the surgery. I've got this amazing view, this 3D stereotactic view, and I'm able to move these instruments with both hands, articulate my wrists, and do everything that I would do on the actual patient while sitting down and relaxed and getting a better view, a more magnified view, and then with the fine-tuning movements that I can have and articulating my wrist, I can do a more fine and meticulous and detailed surgery. So I'm doing the surgery, but the hard work or the grunt work is being done by the robot.
Is everybody that comes into your office and says, I want a robotic procedure done, does everybody fit into that? That they qualify? they meet the requirements to have a robotic surgery done on them?
Most patients do. I would say 98% of patients qualify for robotic surgeries. Now, there's some surgeries, like for instance, just recently I had a patient with a gigantic benign fibroid uterus. I had to make an incision, a laparotomy incision, or I had to open her up because it was just too big. You know, it's safer and easier to do it with a laparotomy incision. I mean, the uterus was the size of a basketball, but 99% of patients don't have that, and they can be done robotically. So yes, the majority can be done robotically, and again, the benefit is less blood loss, less risk of complications, especially the wound incision. That's what we typically see when we do these laparotomy incisions or C-section incisions, is the wound breaks down. There's a 10 to 20% risk, especially if you're overweight or obese or diabetic or have other risk factors. So there's a significant risk of wound infection or wound dehiscence, which is eliminated pretty much with the robot. The other thing is, less blood loss, and also the patients typically, most of my patients get to go home the day of the surgery. They're outpatient surgeries. The majority of them are.
So their downtime is less from the actual procedure to when they can get back to work again or life again?
Yes, typically the majority of my patients can do the majority of their activities in about 2 weeks.
And so, we talk about Memorial Campus, and really I think our expertise and our experience in robotic care. Why do you choose to do your procedures, your robotic cases here at Memorial Campus?
Well, like I said, you nailed it. You guys have a very dominant robotic presence here in El Paso. This happens to be a location that's excellent for me as far as for my patients, my office, and the staff that you have. I've been doing the majority of my cases here for quite some time. The staff are amazing. Having 3 robots means that I am able to schedule my patients here. The staff are fully competent. I'm able to be efficient here because everybody understands the importance of being able to get the cases done in a timely fashion. And like I said, the most important is just the competence of the staff. Everybody's just very competent and good at what they do. And I'm the captain of the ship, but it's the people around me that make me successful in doing a surgery and having good outcomes, minimizing my complication rates, and all it all has to do with just having a team that understands and gets the big picture.
And so if you have to give advice to somebody coming in, whether your office or somebody else's office, and is interested in robotic surgery, what would you tell them to do?
Well, I would say, doesn't matter what area it is, just make sure that you're a specialist in the majority of specialties that do robotic surgery. Have a pretty good presence here at the Tenet system, and like I said, whether it's the general surgeons, urologists, the gynecologists, everybody, the majority of the specialties that people need do robotic surgery. And again, there's a reason that the robot has become so successful in the last 10 to 15 years, is the fact that it really offers advantages to patients that are not really there if you do traditional surgery or even laparoscopic surgery.
So, for me as a patient, I'm coming in, I'm a little scared, I'm a little hesitant. What should I be talking to you about? Okay.
Well, number one, there are certain specialties that don't do the robot, but there are certain specialties that do. So you ask your surgeon, can you do this surgery in a minimally invasive fashion? If so, are you doing it laparoscopically or robotically or arthroscopically if there are orthopedic doctors? And you ask them about the experience of the surgeon, how long have they been doing it, what kind of volume do they have, because the studies clearly show that the more you do, the better you have as far as outcomes and lowering your complication rate. So what kind of experience does the surgeon have, how comfortable are they, if the robot is available in their specialty, why are they not using it, and just those are questions that patients should ask, just mainly, like I said, about the skills and qualifications of their surgeon and what they can and cannot do as far as minimally invasive surgery, again, to speed up the recovery time and minimize your risk of complications and getting good outcomes.
Well, this has been great information. I want to thank everybody for listening. Dr. Asgharian, I want to thank you for your time. Thank you for what you do, and thank you for what you do for our community.
Thank you so much. I appreciate it. Thanks for having me.
Thank you.
Thank you.
Appreciate it.